We have Aleph from Georgia, use he, him pronouns, wants to talk about transitioning before the age of 18, wants to ask about like why are so many of these policies attacking children directly. Aleph, you are live on the line. How's it going?
Hi, it's going good. How are you doing today?
Doing pretty okay
Great.
so far.
Hello?
So
Lay it
yeah,
on
what
us.
do you
What do
Oh,
you
want to
got?
sorry.
chat us?
Yes.
Yeah,
I
go
do
ahead.
want to say I generally agree with you guys were saying up and when you're talking about adults. The problem that I generally have is when this goes down to like below 18. Because now you're talking
Mhm.
about children like in elementary or middle school or high school. It's a little bit grayer at the end of high school, towards the middle of high school. We allow late teens to make a little bit more decisions in their life and other aspects, but we still restrict them. We even restrict them a lot in a lot of other area places, and that even includes up to having sex and who you have sex with, and even being able to do that. I know a lot of late teens do it, but it's still generally prohibited by parents broadly. So my question is like with so much with all of the uncertainty that comes about with all of this transitioning and all of the jargon for what is the difference between like me for my position, gender and sex are the same thing. A woman means an adult female, a man means adult male. So, and I get that your position on that is different, but because there's so much uncertainty with it, I would say, why would we allow children to undergo these type of procedures, or even I don't even know
Sure.
if the two of you even
So
agree that we should.
I
so
kind of want
first,
to
I'll
understand what you mean by uncertainty. Like, I want to just clarify
yeah,
that
I
before we
was
get too far
well.
into this.
I know, yeah, I was about to address that directly because if you look at uncertainty, the medical community, 99% of the medical community in the United States, from the American Psychiatric, Pediatric Associations, the American Medical Association, pretty much every doctor is a part of those organizations, all agree that transition related healthcare is appropriate for all ages of care. So I also want to mean like if the entire medical associations of the United States are all okay with this, what is the uncertainty that you're talking about?
The uncertainty would be that I every time I tend to look this up, it's generally not as cut and dry as either side being absolute certainty or having that much, what you say, 95% certainty. I don't
Well,
generally
think
find it to
about
be
the
50-50,
American
but I generally find it to be
American
60-40. And I'm just talking about America. Like I don't generally look
yeah.
Well,
for
so
studies
I want to
outside of
clarify,
America.
Aleph. I think what you're looking at is you're looking at like public opinion polls, whereas when we are discussing what is the most effective treatment for what we consider this a medical condition, like being trans is considered a type of medical condition that you receive medical treatment for. So when we want to know the answer about like what's the most effective medical treatment, I don't look at opinion polls. I go to the organizations that have a commitment to patient wellness, and I look at what they have decided is the best practice. And it's not just what they've decided is the best practice. That was not a great way to phrase that, but rather we've gone through various stages throughout the last 100 years of like how do we treat people who say that they have a gender that is not congruent with the gender that they were assigned at birth or the sex that they physically have. So, like, what do we do? Well, we've tried different things. We've tried to give them psychotherapy. We've tried to get them to do types of therapy that are like acceptance related, just accepting your body the way that it is. We've tried to give people antipsychotic medication. We've tried to give people antidepressant medication. And we have found through this trial and error that the best way medically to treat the distress associated with having like gender dysphoria is what we call it. Like the best way to resolve that stress is to give people medical transition. Or in the case of children, it's just a matter of like socially letting them get a new haircut, maybe letting them try different clothes, maybe trying out a hobby or something that is different from what they have done before. So, yeah, that's just like how we've come to determine like what's the best course of action here. And so when people are talking about, oh, there's so much uncertainty around trans issues, I'm wondering where that uncertainty comes from, because that uncertainty is not coming from any of the doctors involved or the patients involved. I mean, there's very occasionally people who regret some, procedure that they've gotten, but the number of people who seem to regret transition related procedures is much smaller than, for example, the number of people who regret having a nose job. So, are we going to now try to make it illegal to get nose jobs? Are we going to say you need two therapists to sign off before you get a nose job? Why is trans stuff being treated differently? So that's where I wonder, like, what do you mean by uncertainty? Because medically, there is no uncertainty about the best approach to treatment.
I would say I wouldn't allow a child to get a nose job, just to throw on that point real quick. But what I would say is, like, children are very, very impressionable, and their imagination runs wild. The uncertainty comes in is where they're identifying to be a girl. Like, you say a boy is identifying that he is a girl. What does that actually mean to that boy? Because it can't just mean I identify being a girl because I want to wear dresses. I identify being a girl because I want to wear makeup or heels. Children play dress up and stuff all the time. That doesn't mean.
So yes. This is a conversation that goes on, is discussed a lot, and I just want to mention really quick, and is the fact that every major medical association agrees that the best treatment for gender dysphoria is transition related healthcare. So,
including for children, to be clear, medically
yes,
speaking.
including for children. So now let's start with your question, right? So what you're talking about is imaginations running wild and da 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 da. Yes, children's imaginations will run wild and they're great. And that's the beauty of being a child, right? The creativity of a child is probably one of the greatest things that we can experience if we're raising children or around children and all of that. It's a great joy to be around. But in reality, and when we think about this, right, because I said gender dysphoria, do you believe in the practice of pediatric psychology? I want to ask you that right off the bat. Do you believe in that?
Yeah.
Okay, great.
You mean like helping raising like children and.
Sure. So I wanted to say, like, first off, if you agreed with pediatric psychology as a premise of there are professionals out there that are incredibly skilled and talented and educated on being able to decipher what is happening with a child that is medical or a part of their imagination. So for example, if there is the unfortunate case where there's child abuse, right? If a pediatric psychologist can talk to that child in a way that allows them to decipher what is actually happening and what is in the kid's imagination. So we already know through practices of pediatric psychology, there are professionals out there that are able to cut through the noise of that thing that you are talking about. And that's what a trained professional is going to do. Myself, I am not a pediatric psychologist. I cannot cut through the noise and figure out what if a child is giving me their imagination or if it's a lived reality. That is why there is a diagnosis called gender dysphoria. So what we know through the science of pediatric psychology is that it has to be insistent, consistent, and persistent gender dysphoria. And what we are able to see is that children who are able that do this to go through years of psychological care. So, for example, before a child even sees any type of medical treatment, such as puberty blockers or hormone care, they have to have over a year's worth of psychiatric care that allows a doctor to clinically, because it is a clinical thing, to clinically diagnose a child with gender dysphoria, which again is persistent, insistent, and consistent gender dysphoria. So when we're able to then diagnose that child with that, then they're able to go into the medical process and the medical system, which is doctor prescribed healthcare, by the way. It's doctor prescribed. This isn't something that is just willy-nilly given to children. This isn't just a parent able to just give their child care. This is having to go through the medical system. That is why that transition regret rate of like people detransitioning is less than 1%, which we know that regret rate with knee surgery is over 20%. So right off the bat, medically, they're doing a very good job of the stringent process of what this is. So what does this amount to? Well, this amounts to being about 400 kids a year being diagnosed with medical care that would require them to get puberty blockers or possibly hormone replacement therapy. And incredibly rare does a knife ever go around that child. Like so bottom surgeries are usually out of the question. It's very rarely does it ever happen before the age of 18, because first off, your body's still growing, so a lot of surgeons want you to be fully grown to be able to start doing these surgeries. The most times that you will ever see surgeries happen is if it is a teenager that has already started their androgynous puberty, which is the puberty that they were born to have, and they're a trans boy and they have already developed breast tissue. And essentially, what doctors have to evaluate with that is if the boy is binding their chest really tightly so they can fit in with their friends that are boys as well, they can do severe damage on their growing spines. So the doctor has to make an evaluation of this child of like, is this kid going to continue to bind and compress their spines, which can cause long-term lifetime compression damage to their spines for the rest of their lives that they have to deal with? Or is it easier to go ahead and do the chest surgery and chest reconstruction for that child to have that relief so they can continue to live their lives and grow and develop as full adults the way that they want to live? So, and even in that scenario, it's about maybe 5,000 people that have gotten those type of surgeries over the last 6 to 5 years. So we're already talking about a very small sliver of these population of children. And the reason I explain all of that is because what you said at the beginning, children's minds can run wild, their imaginations can run wild. Great. That's why we send people to pediatric psychologists that are able to see what is true and what is not. And that's why gender dysphoria diagnosis is required for all of these procedures to even be contemplated to begin with. Does that make sense?
You still with us,
You
LF?
still there? Your phone might have fell
Yes,
asleep. Wake
yes,
up your
yes.
phone. Okay, go ahead.
No, no.
You can.
So yes, I agree to like a lot of the stuff that you said. I do tend to just agree with, and it's very good information. I also agree with like parents being able to make the decisions of like for their children, like because what you're explaining to me is that it's a dual effort between parents and doctors or pediatricians and doctors who are making these
Absolutely.
ideals for these children. My
Mhm.
only disagreement is, and you could say that this is just misinformational news, is when it's happening in school without the parents' knowledge.
So
Is that
there
Do
like
is
you
no
mean,
wrong
medical
information
procedures.
or?
yeah, there's no social, there's no medical stuff happening in schools. Are you just saying you don't like the idea that like if a parent doesn't want to affirm their child, that the teachers should also not use the name that the child prefers?
Um, that's a good question. With the information, normally I would have said I would agree with the parent in this situation, but with the information that you've given me, that's going to be a little bit different. I normally give that type of power to the parent. Would you disagree with that? If so, like why? Why would you like not give that to the parent?
Well, we know that. So when we study the effects of whether we let people transition or not. So let's say we have a 12-year-old who was born a boy and they say that they identify as a girl, right? Let's just say we have an example and like that. And let's say we even have two of that kid and one of that kid has like an affirming parent and the other kid doesn't have any affirming person in their life. We can look at this and it bears out repeatedly that the kid who doesn't have even one supportive person in their life is significantly more likely to have extreme poor mental health, like being depressed, suicidal, having a difficult time completing their schoolwork, having a difficult time making and keeping friends, like kids who have a hard time getting out of bed in the morning because they are so in a bad way, mentally speaking. So even just one person makes a significant statistical difference in those social mental health outcomes for children. So if we have a parent who is not affirming, it's very difficult for the child to have that situation where all they want is a haircut and dad says no. Um, so if we then have even just one teacher at school that the kid can talk to who will affirm them, who will say, you know, I understand this is what you're going through right now. And it doesn't, I don't need to say as a teacher that this is a permanent thing or it's a phase or anything. I'm just going to be here and listen to you. That is a significant improvement for the mental health outcomes. So if you just have even one class where you can use the name that you prefer, it is significantly better for the child. So, like, I run into this issue where there's this parents' rights discussion. But like, I think children are people. And I know that that's like a radical thing that, people don't really understand that like they exist separate from their parents and they deserve things that their parents might try to deny them. And we as a society have already agreed that that's the case because if you don't take your child to public school and you're not appropriately homeschooling them, that's neglect and your child will get taken away from you. So we recognize that even when parents want to deny the child something, there is a mechanism where we say there's a certain line that you can't cross. You can't like beat your kids. You can't deny them food. You can't take the door off of the hinges. Like they have rights because they're American citizens. So to me, I don't see why the parent should have control over what name the kid goes by when they're at school. And I think that it would be very authoritarian and morally wrong to give parents the option to disrupt the kids' social acceptance and learning, if that makes any sense. Because it makes
Yeah, I mean
learning
that
hard
makes
for
sense.
kids
I
if
mean,
you
Yeah.
don't affirm them
So,
too.
Elf, and can I, Elf, can I also interject here? And once this happens, it's not like they're going to the school nurse and getting hormones, right? Like that's one thing I want to be clear as well. And I have a more of a question to you. Did you ever have a teacher when you were growing up that you kind of were like really good friends with that you can find with, like maybe even a coach that you would like tell things to your teacher that maybe you wouldn't tell your parents? Did you ever have that in your life? Like a teacher that was really impactful in your life? Have you ever had that?
not necessarily. No, unfortunately, I kind of was going from school to school when I was younger.
Okay.
But
But you
I
do know
did
it
meet
exists,
kind
right?
teachers throughout.
Yeah,
Right.
exactly,
Yeah, for
right? So
sure. Like if I
let's
had
say
stayed at a
something.
school long enough, I would have gotten it.
Yeah,
Mhm.
exactly. And wouldn't you think that would be a betrayal of your trust if you did have that conversation with those teachers and those teachers immediately were calling your parents saying, "Oh, by the way, your kid was talking to me about all of these different things." Da, 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 da. That would kind of betray the trust of you and an educator. And it's really that level we're talking about, right? So like if it happens all the time with kids who aren't trans, where they're able to confide in their teacher saying, "Oh, I really like this boy," or things like that. Or maybe they're like, "Oh, I want to be, a singer." But my family doesn't want me to be a singer. They want me to be a computer engineer, for example. Like that kid would probably be pretty upset if that teacher's like, "Oh, by the way, your kid wants to be a singer, and I just wanted to let you know." And then all of a sudden the kid comes home and the parents like, "What is all this conversation about you wanting to be a singer that you're talking to your math teacher about?" That would be horrifying for that kid, right? Because it's like, whoa, I thought that teacher was cooler than that. I didn't know they were just going to go and just tell my parent everything. So that's why I'm sure you've heard the phrase "it takes a village." to grow to raise a child. Well, the education community is part of that village. And if you're a good educator, then you want to have the best interests of that kid in mind. And so that's where I kind of take a look when I think about these conversations about kids wanting to explore different things, because they may not know, right? They'll be like, hey, call me, I don't want to be called Samantha, call me Sam. Right? Can we do that for a little bit? Because I don't want to tell my parents, because my parents love the name Samantha and they would get so mad if I was going by Sam, but I really like Sam, right? And Sam is neither, male or female. It can be either. So again, it's like one of those little things that we don't think about, that kids ask. And that's really where the conversation is. Does that make sense?
Yeah, I mean, that makes sense. I would say two things. I would say even though I disagree with like children being raised in a religious household, I'm atheist agnostic. I would say,
Mhm.
we still afford that right to parents. And it's like when I think about it, it's like if someone is Christian, like, I don't know if it'll be good if that child is, told that they could be a different religion, like Muslim, for example, and then they're confining into some Muslim teacher about something like this. And then now this child in their head is being converted to, Islam.
Yeah, but I don't.
That's kind of like uh-huh.
The way I look at it in that case, and is this, it's like, as an educator and as a parent, and I think this is something that Lux was talking about as well, is we don't get to determine the outcomes of the child's self-discovery process. If a child wants to explore other religions, or if a child wants to explore different identities, if a child wants to, cut their hair short, or want to, or change their hair color to brunette instead of blonde, these are all milestones in a child's life that is about the self discovery of that child. We do not get to determine the outcomes of the way the child does that self discovery. And I think that as an educator, I think it's critically important for people to be able to explore what different points of view that exist outside of just the household itself, because like you said, like, as someone who is an atheist, you're like, the if you truly believe that it's kind of screwed up that kids are being raised, Christian in their home, then you understand that there's a narrow set of beliefs and boundaries that kid has to live in. So the idea that exploration of understanding, hey, Christianity is not the only religion out there. There's actually many religions, and there's also some people who don't believe in any of them, is just part of the education process of life. Now, I do not believe a teacher, regardless of their faith, should be having, closed door prayer meetings with their child, because I think just fundamentally religion and education and separation of church and state is very important to me. And I don't want state funds going into religious practices in school. I do believe that is something that shouldn't be explored in that way. But as far as letting a kid explore and know the idea that other religions exist is not a problem. So if somebody was like, hey, let me put it at this scenario. Let's say that a parent is like, hey, I don't appreciate that my kid is taught math by somebody who wears a hijab. That makes that kid ask questions when they come home, and they ask questions about, hey, why does my school teacher in math class wear hijab? Now we're reaching the levels of discrimination in a way that is like, oh wait, now you can't even wear a hijab because it may make their kid question of there's an idea of outside of Christianity, because that's much more likely to happen than the person with the hijab coming in and trying to minister and convert the child, right? And that's kind of where these lines are, right? Just the same, like, I wouldn't approve if a trans teacher went up to a kid randomly and says, hey, I think you're trans, are you trans? I don't approve that either, right? These are self-discovery situations that these now, if the kid identifies as trans and there's a trans teacher and that kid's like, hey, I think I'm trans, then I think that is a completely different conversation, because that is something that is not initiated by the teacher. That is something that the kid is bringing up as their own self-discovery mechanism. So does that make sense, that there's a delineation there, that I do believe there is a difference? Does that make sense?
Yeah, I mean, I think that there's a difference as well, and I tend to agree with you in that regard. As long as like, I think have a child having someone to confide into is very important, as because there are situations where what if the child is being molested? Do you not want that child to be able to reach out to a teacher in that sense? And I think everyone would probably
Exactly.
agree that you probably would want a child to be able to have someone at school that they can reach out to. But
Mhm.
as long as the teacher's not cutting off their hair, they're just restricting it to like
Right.
pronouns that or name. That's different
Yeah.
because it's not like I'd mind if my teacher called my son Peter Parker because my son wanted to be Spider Man. So I
Yeah.
mean, I wouldn't cherry pick one versus the other. I
Yeah.
would prefer he not be
Exactly.
one to call Brittany, but at the same time, if it's more comfortable for his environment at school, I'm not gonna lie. I personally would like to know if that was going on at school, but I know all parents are probably not level headed enough
Right.
to be able
Right.
to take that and strive and allow their child to thrive in school and then do this one way at school and another way. You get called Brandon at home, not Brittany, and be
Right.
okay with them being called Brittany at school, for example. I would say my other question for you was so how young are we talking these like what grade level or age level are we talking about these transitions even starting? Maybe I could be getting misinformation on the age level. Are we talking like elementary or older?
Well, I mean, kids figure this out on different timelines, right? That's one of the important things to know about child psychology is that you have to be aware that different children are developmentally in different places at different ages. And so maybe you have a kid who's 5 who feels very strongly like I want to be a girl, and they ask questions like, "Mommy, when am I going to grow boobs?" And then they get really upset when the mom says, "Well, you're not going to grow boobs because you're a boy." Like there is as early as 3 years old, like if you give kids like the opportunity to if you give them the language, which they already have the language, if you say the difference between boys and girls, kids can articulate how they feel at that young age. Now, we don't we will hear them and go, okay, so what I'm hearing is you want to play with different toys or something when they're that young. I realized I was trans when I was about 14 or 15. It was like basically in the deepest throes of puberty is when I kind of realized like, oh, this is not working for me. So, and then some people don't realize it until they're 65. So, basically just giving kids at a developmentally appropriate point. Like, so, using the language that is appropriate for them at that time, which we do with all kinds of things. Like, we also do this, like you said, with like wanting to make sure that children aren't being molested. We use the language that a 5-year-old understands, where we say, oh, these are your bathing suit parts. Like, this
Private
is
parts.
your swimsuit parts. Or private parts or whatever, like making sure like nobody's touching you in a way that makes you uncomfortable, but like using the language that a kid understands, right? Nobody should touch you any place that your bathing suit covers is kind of like the go-to. And then if they're older, then you can have a slightly more advanced conversation. So when we're talking about young kids who are in the elementary age, it does tend to be like, okay, I hear you. Let's try this in play at home. Like, let's try a princess dress while we're playing tea party at home. And then if that is persistent, if the kid is clearly much happier during that, then you might take them to the psychologist, right? So it's got to be a fluid situation where families are allowed to explore this with their child, where there's not like a huge stigma to maybe, asking the school like, "Hey, do you mind using this other name or whatever?" Or, they're 8 years old, there's no sex differentiation yet. Can they play on the girls team? There's no difference at this, stage or whatever. Like just so long as we're taking it and letting the child lead while also understanding that this has to fit within that medical paradigm or we can't move forward.
Yeah, and I just want to mention this as well. Let's say in this case that I know a 5-year-old or a trans girl that knew when she was 5, and she's still under psychological care for a pediatric psychologist. When we're able to identify, let's say what Lux is saying, like 4 or 5 years old, what that means is that they go to a pediatric psychologist to start doing the diagnosis criteria of insistent, persistent, and consistent versions of that gender dysphoria. And after all that time that passes, all the way up until probably about 9, maybe even 10, sometimes even 11, that's when the conversation starts about maybe puberty blockers. So if you have a child who is 5 years old that has been clinically in the system, being observed by a psychologist that is able to diagnose that child with gender dysphoria, that's when the conversation at the age of 9, 10, 11 begins about puberty blockers. And the reason we give blockers is because it gives that child more time to think and contemplate before you actually do the permanent effects of cross-sex hormones, right? And so that is what the system is. So just remember that no medical treatments are happening to these kids until as early as 9. And also, I also want to mention this as well. If you have a kid who's like 7, and let's say they're not trans, right? And they start having their period at 7, or they start growing a beard at 7, you probably want to stop that. That's called precocious puberty because it's happening too soon. And then they were given puberty blockers until it's a healthy time to start their puberty. So that already exists for cis kids, and that's been being done since as early as the late 1970s. So it's like we've know the effects of these puberty blockers. So if a child, let's say at 10 or 11, 12, is like, okay, you have to make a decision which hormones you want, and that kid's like, actually, I want to just develop as my endogenous puberty, is essentially means that they can just go off the puberty blockers, and then they develop puberty wise the way that they were assigned at birth. So that's really what it is. So yeah, these procedures aren't happening to young kids. These are really critical decisions that are doctor prescribed healthcare involving the family of that child, and even the child has agency of being able to say, yes, I want this or not, because we want to make sure that this is happening at a time where a kid can say yes and no. Does that make sense?
So now my question would that does make sense. So I guess my only problem would be is what happens to a transgender child who is experiencing transgender dysphoria and they do not have the support of their parent by the time they are like 9 to 11 or 11 to 14. Like what happens to those children? Because then
yeah. So right now, those children in the United States are not able to access that medically required healthcare. And that's just how it is. There's just no way that the state can take a child and give them hormonal care, because again, it will have to be absolved through the state. Like, so now if there's evidence of child abuse for it, right, where like if the child is like, no, I don't want to cut my hair, I don't want to cut my hair, and the kids are forcefully and the parents are taking, and there's like documented versions of child abuse because of their gender identity, then the state can get involved. But right now there's really no system or mechanism outside of a child doing the emancipation process for them to be able to go against the parents' wishes. And you are familiar with the emancipation process, correct? Where a child is able to say no.
Not for children.
It's usually
because it's a
teenagers.
certain age. Yeah, it's
you have to like
teenagers
prove
have to
that
go through that.
you have to prove that you can
Yeah.
support yourself. You have to have a job. I looked into it
It's a very
extensively when I
high
was a
standard.
teenager. Yeah, so which is
It's
to
a
say
very
that
high standard.
children,
but that's like by the time you're
children,
like 14 to 16, right?
Yeah.
so
Like
Yeah.
somewhere in there.
children who
Exactly.
don't have their parents' support just don't get this medical care. Like that, they
Yeah, it just
simply
can't
have no recourse, no matter how harmful it is for them. Unfortunately,
Yeah.
which is part of
That's
the whole
where we
like
are.
kids belong to their parents thing that I have a problem
Yeah.
with,
But but
obviously.
but that's that but right now with the law right now, that's how it is. The parents have to approve of the doctor prescribed healthcare.
Yeah, I mean, I was put out as a when I became atheist agnostic. I was made homeless at
Mm,
16 as a result of that.
There you go.
So I can just
And
imagine,
that's
what it would be in the
yeah,
reverse
and
yeah.
of
that's
having to, get a job and
yep. And then being trans on top of that, and that happens all too much in our society right now where kids are getting kicked out on the street because they're gay or trans. It's a
Actually, I
huge
think the
reason why
majority
there's
of
a
homeless
giant
youth are LGBTQ.
yeah, exactly, because parents just kick them out on the street.
Mhm.
And it's really tragic and it's sad and it's awful. And that's where we are in our society. That's why all this misinformation that's out there is so dangerous, right? Because it actually hurts children at the end of the day for people who don't want to accept their children for who they say they are. Because if a child's getting kicked
yeah, I
out of
mean,
their
because
home,
if
I
I
can
had
tell
a
you it's not
child
their
that was
imagination.
right, it's like if I had
Go
a
ahead.
child that was experiencing that, as much as I would disagree with their decision, there's no way I would abandon them. Um, in
Yeah,
fact, I
exactly.
would do
And
what
that
we just
makes you a
talked
good
about. I would
parent.
go to a pediatrician
Yeah,
and I would talk to doctors and I would do all those things. And
exactly.
even
And
if,
you,
because I do have my own biasness, I would probably end up disagreeing with the doctor. I couldn't look at my child who is suffering and say, because I disagree with this lifestyle and I disagree with the doctors, if this does help my child, like is there good evidence that it does help, it
exactly.
would help my child to do all these things. I don't understand, like, but a lot of people are rational as atheists.
Yeah.
I've seen the atheist
Well,
experience episode, and we see how people are rational in that area,
and
and
Mhm.
I'm
they disagree
and
with
so I
religion.
absolutely, and we're gonna have to wrap this call up here in a second, but I'll leave you with this. I'll leave you with this. And heaven forbid, like a child has like a chronic medical condition that actually hurt, like let's say it was cancer or whatever, you wouldn't listen to general population opinion on what to do. You would listen to the doctors, you would listen to the experts in the field, you would listen to the people who are clinically trained to deal with that. So if it was cancer or if it was like an appendicitis or something like that, it should be the same thing for gender dysphoria. If your child is exhibiting gender dysphoria, you would hope that the parents lean on the doctor's advice and not some politician out there, right? And that's where my biggest contention is like we should always follow the advice of medical doctors that are providing doctor prescribed healthcare and their clinical experience when dealing with your child, than rather some freaking government fat cat sitting somewhere saying, no, I want to tell you what you can and cannot do with your children. And that's where my self is just like, it's about right to privacy, it's a right to bodily autonomy, and we should be able to give the health care that your doctor and your family approves, that says it's okay. And putting the government in that in any such way is just wrong and antithetical to our freedom as Americans.
I agree. I
Yeah,
definitely agree.
yeah,
Even though I disagree with the lifestyle, like I say, if I had that type of, like, because like when it comes down to adults, I believe adults have you can believe in what you want, and like I heard you guys say earlier that you don't choose to be gay or you don't choose to
yeah,
be these things. I agree. I couldn't like a guy if I tried.
yeah,
I couldn't find him
exactly. It's the
attractive
same thing.
in any sexual way if I tried to. So there's no way
Yeah,
you're going to convince me that a guy is saying he's attracted to a guy. He's just choosing to do that, because I don't, I can't even,
yeah.
when you really get into the philosophy, I can't even really tell you why I'm attracted to women. So
So
Yeah.
I
yeah,
just
so
am,
we're gonna
you know.
wrap this call up, and I would love for you to call in again, and so we can discuss that part, because I think that's another great conversation and talking about like the understanding of trans people and getting back, because I'd love to dig into your initial statement in the beginning of this call, such as you think gender and sex are the same thing, and I would love to jump in with you on that. So please call again so we can start investigating that part, because as an atheist, we have to be skeptical of our beliefs. We have to question our beliefs. So I hope that you would join that journey with us in the next call. That you call us again, please. This was a great call. Thank you so much.
I absolutely, no problem. I absolutely will. I really appreciate you, Lux and Josie.
Yes.
Yep, you got it. All right. Thanks, Aleph. We'll talk to you next time.
Awesome,
Thank you.
awesome. I really appreciate it. All right.
All right,
Bye-bye.
bye-bye.
Hey, thanks for watching that clip. Did you know we saw what you were doing when you watched it?
We saw all of it. All of it. All of it.
So you're going to want to pay us hush money over at patreon.com/calltheline, where you can buy our silence and watch our patron exclusive podcast.